Hey eyes and shine, my friends and colleagues, and welcome to the I Give a Damn podcast, made possible by Fluorescene Media, the same company behind ODs on Facebook. Now, I first want to start off today by first thanking our video sponsor, that of Lens Therapeutics. Now, if you are a doctor who's ever prescribed for presbyopia, then I'm sure you're a master at bifocals and progressives and multifocal contacts and even surgical options for your patients, but you've been probably pretty excited with the development of presbyopia eye drops. Now, I've been digging into the research and reading kind of what's coming out, and it's kind of fascinating because we really only have three miotics. We have pilocarpine, we have carbachol, and now we have aceclidine. And if you're not super familiar with aceclidine, that's okay because it's just coming to US markets. But aceclidine is pretty special because it is a selective miotic, meaning it predominantly affects only the iris sphincter and doesn't activate the ciliary muscle, meaning you can therefore avoid the myopic shift. And again, unlike the other medications in development, aceclidine is the only one to achieve a below 2 millimeter pupil size, which, if you recall from your education as a student maybe, or in your vision science classes, a pupil size below 2 millimeters is really ideal for improving depth of focus. And what I find most fascinating about aceclidine, at least in what Lens Therapeutics has put out in their phase 2 studies, is that it shows a duration of 10 hours with a single administration. That means patients might be able to just put in an eye drop and then reduce their need for reading glasses or anything for 10 hours without having to put more medications or drops in. Either way, I think it's all super fascinating and something that we should all be paying attention to. Otherwise, thank you again to Lens Therapeutics for sponsoring the video. My guest today is none other than Dr. Nate Lighthizer. Dr. Lighthizer is an associate professor and associate dean at the Oklahoma School of Optometry. He is a founding member of the Intrepid Eye Society, as well as probably being what I would consider one of the more famous lecturers giving CE, as he talks on a lot of advanced topics, including ocular disease, electrodiagnostics, and advanced ophthalmic procedures, including lasers. And today we discuss not only how Dr. Lighthizer found optometry as his profession, but how he kind of found his love and passion in ocular disease and performing advanced ophthalmic procedures. We also discuss scope expansion, as he lectures on a lot of the topics that are kind of front line when it comes to optometry and scope expansion, and how politics doesn't always follow logic. And then ultimately, Nate sharing where he views optometry heading from here. Now, whether you are listening in on Spotify or watching us here on YouTube, please do us a favor, hit the like button, subscribe to our channels, and even better, leave us a review. If you are somebody who gives a damn about optometry, about your profession, and you love listening to other healthcare professionals who also give a damn about what they do, then please go ahead, leave us a review. It'd be a huge favor. Otherwise, without further ado, let's get into our conversation with Dr. Nate Lighthizer. Well, Nate, again, thank you so much for being here. This is always an honor for me to meet other distinguished people in our profession. You're somebody who I've seen give multiple lectures, and I've always just enjoyed the lectures that you have given. They're always top-notch. They're always kind of in advanced topics in the realm of optometry. And so, yeah, this is a huge honor. Thank you for being here.
I appreciate the invite. Thank you for having me. I'm looking forward to our conversation and just talking optometry, talking eyeballs.
There we go. As far as for our viewers, listeners, who haven't had the luxury of maybe seeing one of your lectures or reading an article or anything like that, or who didn't go to school at the Oklahoma School of Optometry, right? And it's in Tahlequah, is that
Tahlequah, Oklahoma.
Perfect.
Yep. Northeast corner of Oklahoma, Tahlequah.
Do you mind just giving us kind of an introduction of how you even found optometry, and then how you found yourself being not only a professor, and now you're like an assistant clinical director or dean? Where are you at?
Yeah, so I'm in Oklahoma. I'm the associate dean. But a little bit about my background, again, born and raised in Bismarck, Mandan, North Dakota. I always had an interest in kind of the medical field, going through elementary school, junior high school. My mom's an x-ray tech, so she, is in the medical field. And my best friend growing up, his dad was an optometrist. And I kind of liked his schedule. He worked about 4 days a week. He was on the golf course on Friday. So it's not a great reason, but I'm like, I kind of like his lifestyle.
Yeah.
He seemed to do very well for himself. He's in private practice in Mandan, North Dakota. So that's what got me interested in optometry. I decided as about a sophomore in high school, I think I'm going to be an optometrist. And it never really changed after that. I went to the University of Jamestown in North Dakota. They're known for their science program, preparing students for medical school, dental school, optometry school, chiropractic school. So I went there. I met my future wife there, who happened to also be going into optometry. And I followed her out to Pacific University. She went the year ahead of me. I followed the year later. We spent 4 years in the Pacific Northwest. And did our optometry school at Pacific, and then got to Oklahoma in Tahlequah. That's where I did my residency. My wife is a year ahead of me, so she was a resident. When I was a fourth year, she did her residency at the Tacoma, Washington VA. And then when she was finishing her residency, I was starting my residency. I went down and interviewed, and in Tahlequah, Oklahoma, selected me as a resident, and they hired my wife as a faculty member at the same time because she was just finishing her residency.
Yeah.
And we have stayed on ever since. And one of the reasons I went to Oklahoma was the scope of practice.
Sure.
At the time in 2009, the only state that was doing laser procedures, one of the only states doing injections. And I really, going through school, was like, man, I love ocular disease. I love advanced procedures, laser procedures, injections. And one of my mentors, Blair Lonsberry, he was my mentor at Pacific. He's a faculty member at Pacific. He said, Nate, you got to go to Oklahoma. So interviewed for residency, was fortunate to get accepted there, and have been there for the last 14 years. So it's been a fun ride. I serve in a variety of roles. I'm the chief of Specialty Care Clinic, which is where we do our laser procedures, injections, director of our continuing education program, and our associate dean.
So it sounds like even as a student, you had some interest in the specialty procedures, right? Your mentors clearly knew, this might be the direction you want to go.
Yeah, I debated actually about my third year in optometry school and dropping out of optometry school and going back to medical school. I seriously considered that because just realized that, boy, I like the ocular disease side of this. I love managing glaucoma, but I really like these procedures, the surgical aspect. I decided not to just because of, boy, that's a big commitment to now go back, take the MCAT, apply, 4 years of medical school, internship year, residency. You're looking at 8-9 years.
Time, finances, all
Correct.
of that.
My wife's an OD, just finishing her program because she's a year ahead of me. And it really piqued my interest, especially even more when I went to my fourth year externship. Dr. Leo Scorin in the Mayo Health System. He's an ODDO, an optometrist and an ophthalmologist. And I spent 4 months with him, and I was like, man, this is cool stuff. Intravitreal injections, laser procedures. I seriously talked with him about going to medical school, but ultimately decided let's go to Oklahoma, do a residency there, and got a training on a lot of the procedures I like to do.
And when was this all happening for you? Like
Yeah.
when were you doing your externships, and when did you do your residency?
Yeah, so I entered optometry school in 2005.
Okay.
I did my fourth year rotations from the summer of '08, and I graduated in May of '09.
Okay.
So that was the '08-'09. I spent 4 months with Dr. Scorin from August to November of 2008.
I'm asking because I'm trying to give my mental, understand when you are learning these sort of procedures and how long they've been going on, because still in a lot of states, we don't have that scope.
Yep.
Right.
The bulk of my learning, SLT, capsulotomy, iridotomy, injection of lidocaine, removal of chalazions, incision and curettage, things like that. The bulk of my learning on that happened during residency. I entered my residency July 1st, 2009 in Oklahoma, and I did my residency for a year where I did dozens and dozens and dozens of laser procedures. That's when we took our what we call advanced procedures course or ophthalmic procedures course. You may be aware of that. We travel all over the country to train doctors in other states on lasers and injections, lumps and bumps. as a doctor in Oklahoma, you are required to take that 32-hour course to get a license. It's a prerequisite.
Awesome.
So I had to sit through the course at the start of my residency, like first week, taking all this stuff. You're learning the didactic, the laboratory, and then I had a year to apply it with an attending doctor over my head because I was a resident. So, which made it very nice.
Do you remember, because I've taken some of your courses, and I'm just curious because in my state of where I practice right now in Minnesota, I still am not licensed to be able to do that, even though I've gone through these different courses. And again, when I was a student back in 2013, 2014, 2015, like we learned lasers in my education, my didactic component. So I wonder, just was there a time when you were going through all of that you were nervous, that you were like, I don't know, or do you just have that mentally where you're like, yeah, let's do it? I'm just curious.
So the answer is yes to both of those. Was there ever a time I was nervous? Yes, absolutely. And it continues to be that way. Okay. I tend to be a personality of I'm going to dive in and let's go for it. But that doesn't mean I'm not nervous about a new procedure or a first procedure. I just did a procedure last week, first time. Treating conjunctival chalasis and kind of plicating or shriveling up that excess conjunctiva.
Sure.
And I'm like, well, it's the first time I've ever done this procedure. I've done thousands of laser procedures and chalazions, but it's a new procedure. And there's always a little butterflies the first time you do something. And I want docs to know and realize that's okay.
Yeah.
You were nervous for your first eye exam, I bet, way back in second or third year of optometry school.
That's a good point.
And you're going to be nervous for your first SLT. You're going to be nervous for your first capsulotomy, my first conjunctival chalasis treatment last week. And you're going to learn along the way. I do things a little bit differently today after I've treated 1,000 capsulotomy plus than I did on the first one. And that's okay. I modify my technique all the time. You're going to learn continually, but it's a very fulfilling and rewarding process to do that. So it's okay to be nervous, and it's okay that the second one goes better than the first one, and the 10th one goes better than the second one. That's okay.
And I think that's just a great lesson to hear on multiple regards, because it is good, I think, to know. I see a lot of amazing professionals in our space like yourself. I see you giving these lectures and I'm like, wow, they know so much, they're so proficient in this, and you speak so confidently in teaching. And there's this weird spot in my head that's like, they just were born knowing this, they were born this good. And I have to remind myself, it's like, no, they went through years of schooling and training and experiences, and that's exactly what aspiring students and other doctors need to keep in mind as they push themselves, right?
Yep. It's okay to go, you know what, I don't know a whole lot about this and be a little bit uncomfortable, but expanding out of our comfort zone leads to good things. You know, it's like, oh, I grew because of that. I know a lot about lasers. You know what I know about contact lenses? Nothing. I know nothing. I haven't fit a contact lens in 13 years because other than a bandage lens, I just don't do that. So just because I may be on the podium talking on lasers, you're like, man, this guy sounds smart. I'm no smarter than you are. I'm no smarter than anybody else on that topic. I have more experience, but you can get the experience as well. So
thank you for just sharing that. That's incredible. I know the other kind of thing with doing lasers and lumps and bumps, and being that not every state has this with scope expansion, like you're teaching the topic that a lot of states have been fighting for decades now, right? And we're getting a couple more states getting a little bit more access, but have you had any frustrations or thoughts about scope expansion? Because clearly optometrists have this training, this education, the capability, and yet we're constantly bombarded saying that, nope, we can't, or we don't have this knowledge, or what I'm just curious of your thoughts as somebody who's doing it and teaching it.
Yeah, I could talk an hour on this one. You know, the frustrations are that we continually get beaten down by the other side, political ophthalmology. I mean, it's a turf battle to some degree. You know, they bang on our training, and I know that you are well trained to do these procedures, even though you can't in Minnesota at this point. But this training is happening in optometry school. Laser procedures, injections, that it is was it happening 25 years ago? Not to the level it is now, but we evolve education and we evolve training. So the frustrating thing for me is seeing when others don't recognize what we do and what we're capable of doing. I've seen success stories in Oklahoma, Kentucky, Louisiana, Alaska, Indiana, Arkansas, Mississippi, Colorado, Virginia, Wyoming, all these states There was one, when I was doing my residency in 2009, there was one state. Oklahoma was the only one doing laser procedures, and now there's 10. And you can see an evolution, and that's really exciting. So that's the exciting part. The frustrating part is I think all 50 should be able to do an SLT if they so desire. I always tell docs, how many of you have patients that struggle with compliance with their glaucoma eye drops? And every hand in the room goes up. You have patients that just struggle with their eye drops. We have 2 first-line options for glaucoma, wonderful eye drops and a wonderful laser called an SLT. Who treats glaucoma first line? Optometry does.
Yeah.
And you should be able to go to both in your practice. In Oklahoma, I can do that. In Kentucky, they can do that. In Minnesota, if you want to treat first line, you kind of got to go more to drops, don't you? So that's the frustrating thing is I think everybody should be able to do this. It just takes some time to pass laws because we are a legislated profession. And we've got to go to the legislature. It's about politics to some degree, and politics is not always about logic. So you got to talk to your senators, talk to your representatives, and make a push to pass a law.
With Oklahoma being where you're at and having so many different options, is there anything else that you could see? I don't know. Is there anything else that you currently can't do that you would love to see or would love to do?
Yeah, that's an interesting question on where will it go from here. We sit here in 2023, and I think we need to look beyond just a year or 2 years or 3 years away. If we would have sat here in 1983 or 1973 and known that we would be talking about optometrists doing lasers, I don't know that we would have believed it because we could barely dilate the eye in 1983. There was the expansion of scope into diagnostics in the 70s and 80s. During my lecture, I always talk to docs and say, show of hands, anybody graduate in here that when you graduated, you couldn't dilate the eyes? And there's always hands that go up because diagnostics was in the 70s and 80s, and then therapeutics in the 80s and 90s, and oral medications, and now we're in the time of injections and lasers. So big picture, to answer your question, will optometry ever be doing intravitreal injections? We're doing injections into the eyelid, lidocaine. There are currently 4 or 5 states that allow optometrists to implant bimatoprost into the anterior chamber, a medication called Durista. I do that regularly, so we now are doing clear corneal injections into the anterior chamber. And we know that retina specialists are overburdened with the amount of patients that need anti-VEGF injections. There's nurse practitioners that are doing this under the license of retinal specialists. Will that be something that we venture into of intravitreal injections? Will it be blepharoplasties? Will it be femtosecond laser-assisted cataract when you're doing lasers already on the capsule? Will we be jumping into that realm? It's hard to know for sure, but I think we need to continue to push forward.
Well, I know it's certainly a lot of the political sides of that. They're always worried that we're going to start asking for more and more and more.
Yep.
And I always try to say, I personally knew when I had to choose optometry versus ophthalmology back in, I don't know, I was in undergrad. I shadowed an ophthalmologist, and I almost passed out in the OR. Just because you always fear what you don't understand. At that time, I had no real education other than just anatomy, physiology, and knew I wanted to do something with the eyes. And I was okay. Cataract surgery is not a problem. But as soon as they brought in a kid, did a strabismus surgery, I saw blood, I almost hit the floor. So I knew I didn't want to be in the OR doing those procedures. But I'm like, I love the clinic. I love the patients. Anything that can be done in the clinic, that's what I want to do. That's what I've been trained to do. And this is a different thing, too. When you went into optometry, did you know the scope, the politics behind all of that before,
I didn't have a clue.
I
did not have a clue. I'm at an optometry school, and people often ask me, well, do more students come to Oklahoma to learn lasers because you guys have the law? And I'm like, I don't think they do, because as a sophomore in undergrad or a junior in undergrad or a senior, you don't have a clue about optometry and the politics behind it and scope of practice. I didn't have a clue what scope of practice was. So I don't think we know enough when we're that young about, the scope of practice and politics behind that. So, it's something you learn as you go through optometry school, and even after optometry school, depending on what state you go into. So,
what do you think is probably the most... for other states, what do you think is probably the best way about just educating the public, not just politicians, but the public, nurses, other healthcare professionals? What do you think is the best way to educate them about who we are, what we do? I'm just curious from your point of view.
I think the more that we communicate and brag on ourselves of what we do, you ask some doctors, well, you're an optometrist, so you fit glasses and contact lenses. Well, we do, but we do about dozens and dozens of other things as well. We'll take that foreign body out of your cornea. We'll treat your red eye. We'll treat your glaucoma. We can manage your macular degeneration. Those diabetics that you see, primary care physician, we'll see them for their dilated fundus exam, their yearly diabetic exam. So I think bragging on ourselves and letting more people know this is what we do. We can do laser procedures, and we can do injections, and we can manage more conditions. I think that's important to let other professions know. I can't tell you the number of times they go, "Oh, I didn't know you could do that as an optometrist." Well, yeah, we train our students every single day on a variety of things, from contact lenses to low vision to vision therapy to pediatrics to geriatrics to surgical procedures and everywhere in between.
And speaking of just like our education and how advanced it is, as we start adopting and shifting our education to a lot of these advanced procedures, do you think it's something that is going to be just rolled into our standard? We have our undergrad for 4 years, our pre-med, then we have our regular optometric education for 4 years. Do you think it'll be rolled into that, or do you think we're going to see more focus on residencies, or maybe a complete other like optometry surgical, like almost extra training, a capstone, or a fellowship?
I think it's being rolled into optometry school with, at the end of optometry school, as you get out, our advanced procedures course, our 32-hour course that really provides that final level of comfort and education of here's what you do, here's how you do it, here's the hands-on. We bring lasers in and model eyes made by ophthalmology, and they're fabulous. But it gives that kind of final level of comfort. But to answer your question directly, every optometry school now has a laser course, a laser procedures course.
Yep.
They have the didactic component, they have the laboratory component, they're tested on that. And the final step is then doing procedures on live patients, which is prohibited in a state where you can't do it. In Oklahoma, we can. It's the beauty of practicing and being in our school is they can get that final level of training. Somebody at a different school may not be able to get that, but that's why the law needs to change so you can get the proper training and help our patients.
And as far as just kind of what's next on as like working with the school and just kind of your career, I know you do so much lecturing and consulting in different ways. Kind of what are you looking forward to for optometry? Are you looking for more procedures? Are you looking to do medications? What are you excited about?
I'm most excited about, there's 10 states that have lasers, and I'm excited to see 20 states and 30 states and 40 more procedures. There's a new medication approved for geographic atrophy, an injectable intravitreal injection. I mean, there's another one that's likely going to be coming out before the end of the year. So we've got new medications to treat more conditions. We've got more eye drops out there. We've got more medications out there, better surgeries out there, drug delivery in glaucoma. Gone are the days of drop 1, drop 2, drop 3, drop 4 in glaucoma. We've got wonderful SLT, wonderful drug delivery. Our surgeons are so good with MIGS procedures. So I'm really excited about the variety of options. But what gets me most excited is traveling around, seeing the excitement on doctors' faces when they learn new things.
Right.
I love education. Somebody asked me yesterday, what are you going to be doing 10 years from now? And I went, well, I hope to continue to be at the College of Optometry teaching students and residents, but I love education. I love talking to our peers and our colleagues. I learn just as much from them than they could ever learn from me, but it's just so much fun interacting, the dialogue, whether it's with industry, and we learn from industry as they're bringing new things to market, but learning from our colleagues and peers, and I hope to continue to have a small part in that.
I was curious, just because you mentioned how industry is kind of acknowledging this advanced training and our capabilities, because I know when I go to expos or around the country, you'll see injection booths about new medications, teaching us about these injections. And I'm curious if you think other parts of industry are going to start inviting optometrists in to do like procedure labs.
Sure.
Have you seen that? Is that something you...
Yeah.
you see coming up down the road?
We have a variety of industry companies that are involved in our laser procedure courses. They provide the lasers.
Yeah, that's true.
There's a delicate balance there because laser companies, while they'd be happy to sell out lasers to optometrists, they also don't want to anger the ophthalmologists as well. So there's a delicate balance there. But laser companies and industry have been excited to see more providers offering treatments to their patients. Ultimately, that's why we do it, is better access to care and more care for patients.
Well, I think this is all amazing, and I can't wait to just personally learn more from you, listening to your lectures as we have been, and then fingers crossed, sometime soon I'll be able to do a few little bit more in my own state. So
absolutely.
Thank you again for being here as a guest on the podcast. Again, hopefully, maybe someday I'll be able to travel down to Oklahoma, even talk to some of your students and present something of my own passion.
You've got a standing invite. We'd love to have you.
Thank you. But thank you again for being here, and I hope you enjoy the rest of your optometry's meeting.
Right back at you. This was fun. Thanks for having me.
Thank you.
Thanks.
So that was our conversation for today. Thank you so much for joining us. If you are enjoying this type of content, please do yourself a favor and follow us either on your favorite streaming service or subscribe to our channel over on YouTube, because that will go ahead and remind you whenever our next episode is coming out. And if you're somebody who is finding a lot of value in this content and also gives a damn about your profession of optometry, then please do us a solid favor by leaving us a review on whatever streaming service you are using. That will greatly help us out and help more professionals find this content. Otherwise, again, thank you for listening in, and I hope you have a fantastic day. We'll see you soon.